Hey, Dr. Greg here at Northwood Chiropractic and Wellness. Today, we're going to talk about chiropractic care and strokes. So most people believe that chiropractors do cause strokes. There's been things in the news as far as an individual going to a chiropractor's office, getting an adjustment, and suffering a stroke within the same day. So I actually have a study that actually goes through that entire history because it happened actually in Canada in the 90s that two individuals actually did go to a chiropractor and unfortunately did suffer a stroke. So an entire study went through and observed a 10-year period in Canada, the number of strokes, who did they see leading up to that stroke or that incident, and we have all the data here, and it's going to be in the link, this study that's out there. So the numbers we're looking at here was between 1993 and 2002. Within this research article itself, and I have a copy again right here, and it's going to be a link available in the discussion for you to look at this as well. But they even cite that a vertebral-basilar artery stroke, or the vertebral-basilar artery insufficiency, it is rare in Olmsted County. So the same Olmsted County, that's Rochester, Minnesota. They observe that this happens in 1 in 100,000 people in a given year. Now, for the anatomy itself, I have this image right here that you can see and observe that its main function, the vertebral-basilar artery, is to actually supply blood to the brain, specifically the lower half of the brain, or your cerebellum, which is there for motor control. So an individual who may have suffered a stroke, they have changes to their gait, they have difficulty walking just because they've lost a lot of that motor control. So in Olmsted County, again, they observed that 1 in 100,000 people is going to suffer this type of stroke. And they did an 8-year follow-up study. And after that 8-year period, they noted that there was no desiccation or no redesiccation or tearing of that same artery. So it lets us know, like, okay, this is incredibly rare. And the frequency that this is going to happen again is almost nearly none within an 8-year period. But the sources that we're citing here, they wanted to investigate the association between chiropractic care and a VBA stroke, vertebral-basilar artery stroke. I'm going to say it over and over again, and compare that to the association of a primary care physician visits and, again, a VBA. Now, my clinical pearl is that any new headache and associated neck pain is my immediate red flag. There's something going on here. A new headache that is happening is that red flag. So that's where I tread lightly. I do a lot of motor neuron testing, do a lot of things to be able to help assess, is this individual in the middle of having a stroke? Is there an artery that's desiccating or tearing as well? And I will tell you, I've observed it once. Okay, I've seen it once. Individual came in, had a number of concerns, that being loss of motor control and function as well with their body, that we told them right off the bat they are not a chiropractic care case. We sent them off to get an angiogram to be able to assess and be able to evaluate where that tear is. Sure enough, there was, and they were able to have successful surgery to help repair that. So it does happen. It is incredibly rare, but that's the clinical pearl, a new headache. Now, moving on with this study, they found 818 VBA strokes met their criteria with 3,164 controls, because there are other types of strokes, but we are looking at, again, the vertebral-basilar artery that is demonized within the media, that chiropractors, cause a lot of tears within this. So this data went through and they observed that within a 24-hour period, for example, if somebody were coming to my office and they're showing all those signs and symptoms, 0.7% of these cases actually have a stroke within that same day. So that being 1 in 14.3 million chance that that happens. When compared to that same time period, again, just within 24 hours, when visiting a primary care physician, 7.7% of cases actually suffer a stroke in the same day. That's an occurrence of 1 in 1.2 million. Now, when we compare the two office visits or types of care, that is a 1,000% increase when going to the primary care compared to the chiropractor. Within a 1 week period. So an individual comes in, they have a headache, get them adjusted, rah, shish kebab. Well, what happens within that 7-day period? Within those 7 days, 1.7% of cases suffered a stroke when visiting a chiropractor, an occurrence in 1 in 5.9 million. But when regards to a primary care visit, 25% of people actually suffered a stroke within that same time period of 7 days. So that's 1 in 400,000 people. And that's across all age groups for the primary care physician, but still more than 1,000% in its occurrence. Chiropractic care, there is a little bit of a change just within the data itself. It's observed that individuals who are under the age of 45, within that 1 week period, there is a higher risk. 7.8% of cases under that 45-year-old period or age did occur a stroke. And that's an occurrence of 1 in 1.3 million. When compared to those older than 45, that was 8.8%, and that's a rate of 1 in 12.5 million. But again, in regards to what we're observing already within 1 day and within a 7-day period, there's over a 1,000% increase in strokes happening when visiting a primary care physician than compared to a chiropractor. So when we take a step back and look at within a larger viewpoint, a 30-day period within 1 month, 4% of cases that had a stroke visit a chiropractor within 30 days. That's 1 in 2.5 million, compared to 53% of cases visit a primary care physician, and that is a rate in 1 in 189,000. Again, over a 1,000% increase when we compare the two offices. Now, here's the recap of it. A vertebral basal artery stroke is a rare event. It's incredibly rare. You can actually turn your head, cough, sneeze, get in a car accident, and have that happen. It is incredibly rare. Now, as I've commented, there is an increased risk in association with a VBA stroke and chiropractic visits for those under the age of 45 years old. But my clinical pearl is that it's a new headache. It has to be treated like there is actually something going on with someone's arteries. They're either tearing, desiccating, or showing early signs of stroke. But when we look at and take that step back, there's no association or evidence of excessive risk of VBA stroke with chiropractic care, because the data should have shown the complete opposite, that there was there was a 1,000 increase in incidences when visiting the chiropractor, that there was another 1,000 within the 24-hour period, 1,000 within 7 days, 1,000% increase within a month. However, that was the complete opposite. That was observed and seen in primary care physician offices, which is going against, whatever mainstream media or, general thought is based on the public. There is an association of VBA stroke and primary care physician visits amongst all age groups. Now, why is this happening? Based off observation, there's an increased risk when going to a chiropractor and a primary care physician, only because an individual is complaining about headaches and talk about their neck pain. But the biggest thing is to look out for those clinical pearls. And again, that just being a new headache. So any individual, my clients who are listening to this, who had a history of headaches, I do ask, is this a new headache that you've never had before? And almost always everyone says, no, this is the headache I've been dealing with and working with. And sure enough, our goal is to eliminate that. And in many, many cases, if not a majority of all cases, we do that. But there was that one chance, that one-off chance, individual came in and I asked that question and they said, yes, I've never had this headache before and it is debilitating, it's disabling, and I'm losing feeling in my arms. A lot of red flags there. Sure enough, we're able to find it. Follow-up study though. This study came in 2022. So again, chiropractic cares and stroke, but this actually has to do with, does spinal adjusting actually help with the recovery of an individual who did suffer a stroke? So Stroke-induced impairments in motor function is common, with almost half of stroke survivors having limitations in walking. Purpose of this study I'm about to cite now is to observe motor function after chiropractic adjustment to the muscles of the lower limbs using a transcranial magnetic stimulation to create a motor evoked potential. Now, this is for the neurologists out there. There's a device that actually goes and can target a certain part of the brain, the motor function of the brain, to stimulate a pathway or a signal being sent through, and have an end unit observing a muscle just to be able to help measure how quickly is that signal sent and how much resistance does that signal go against and what's its amplitude. So I'm going to put another picture right here, kind of describing that unit. Again, something at the top of the head, stimulating the brain, and then a marker or observer at the end unit that we want to observe the muscle function that we're trying to observe. Because for individuals, about half who do have a stroke, it's difficulty walking. Because again, a stroke is going to impact the cerebellum, the base of the brain, whose job is for motor coordination. Within the past 2 decades, there's been multiple studies that have observed that a single chiropractic adjustment modifies the central processing. Your brain is a supercomputer. It is the most advanced supercomputer ever created. That central processing, the somatosensory, so the ability to touch and feel, the motor function, the ability to send signals to move limbs, the actual motor control itself, and pain fibers. Pain is actually a fiber in your body. So that is something that a lot of people associate chiropractors with pain relief. It's like, well, our job is to do more than that. We want to improve the biomechanics, improve the motor control of the area, because ultimately that's where a lot of these things come from. The spine is actually a bridge, and the spine is the bridge of the biomechanical and the neurological connection between the brain and the limbs. Without a spine, there's nothing there to protect it, but without a spine, there's nothing there that's able to help complete that connection. The chiropractic adjustment, specifically what we call the HVLA, high velocity, low amplitude, that's how I practice. So if you are my client, we use hands-on quick adjustments. It's been observed that these type of adjustments increase the strength to a dysfunctional spinal segment. So this rehabilitative, this study focused on the potential of rehabilitation using chiropractic care, had 29 participants that were 12 weeks post-stroke. Adjustments were made primarily to the low back and the SI joints, but other areas as well, based on what the chiropractor decided was best for that patient. And anywhere between 3 to 7 adjustments were made on a single treatment. Immediately afterwards, these individuals who are chronic sufferers of a stroke had that excitability motor put on their head to help observe, what's going on with these muscles. They did that pre-adjustment, post-adjustment. So post-adjustment, they observed, when compared to a control group, a group that did not receive an adjustment, that there was a 126% increase in the muscle excitability to a muscle called the tibialis anterior. Here's another photo right here. This muscle's main function is to lift the toes off the ground and help allow the foot to clear the ground. So we're talking about walking mechanisms. So it observed, just while it's sitting there in a relaxed state, that they were able to send a signal that was 126% better than the control group. And this observed that it improves muscle strength, muscle efficiency, and muscle function. So that's the exciting thing of what chiropractic care can offer people who have strokes, and also people who are athletic, involved in athletics, moving around, being active, trying to maintain a healthy lifestyle. But in regards to this study, more studies are needed to help understand the true impact that chiropractic care can have with stroke rehabilitation. So thank you so much for listening along. I hope you learned something new and insightful. And if you did like this, give it a thumbs up, but as well as that, share that with an individual. We want to help spread the message of what we do here and the exciting things that are happening in chiropractic care.